February is Heart Month, and of course, it's a great chance to learn more about what your lifestyle habits are doing to predispose you to a greater risk of heart disease. Joining us now is Dr. Robert Williams of Bronson Advanced Cardiac Healthcare in Kalamazoo. He's been with the practice since 2003, also sees patients in Battle Creek. He's board certified in cardiovascular disease and internal medicine. Welcome, Dr. Williams. How are you?
Oh, very good, thank you.
Good. All right, so let's talk about that. First of all, I know people kind of think they know what this means, but could you tell us a little bit about what heart disease is?
Well, heart disease is the number one killer in the world. It kills about 500,000 Americans a year. But probably the thing that kills the most people from heart disease would be coronary artery disease or plaque formation in their arteries.
Okay, and so this brings us to the next topic. What causes heart disease? Is it a combination of factors or one particular thing? Or
It's not one thing. It's multiple things. Family genetics is probably the key to most of it. So if you have a family history of premature coronary disease, you want to pay attention. But lifestyle, being obese, being a smoker, having diabetes and hypertension and high cholesterol, all these things contribute.
Well, let me ask you, because some people, I think heart attack and heart disease kind of get mixed up sometimes. Heart disease. What are some of the symptoms of heart disease?
Well, heart disease can be a multitude of things. It can be heart failure, which can just cause shortness of breath and swelling. Things that, like a heart attack, would cause chest discomfort or shortness of breath or becoming sweaty. Sometimes they're hard to sort out which is which.
Dr. Williams, does having heart disease put you at a greater risk of having a heart attack or a stroke?
Well, for sure. It is part of heart disease, but yes, having those risk factors, can definitely increase your risk for having a heart attack or stroke. Any of those risk factors.
So let's talk a little bit about the generations that are coming. I'm a baby boomer, so I've been told, that I have the trifecta of issues. I've had high cholesterol, I have high blood pressure, I have diabetes, but all of them are under control. But the younger generations that are coming up, are they smart in regards to heart disease and trying the prevention?
Well, I think there's definitely more information out there. It's more readily available on the internet, and I think we know a lot more about risk and risk factors. And there's a lot of programs to try to get kids to quit smoking and watch their diet and exercise and watch their alcohol intake.
So there are ways for this generation to lower their risk.
Oh, for sure. I just have to pay attention to what they do on a daily basis and just take care of themselves and eat right.
Talking with Dr. Robert Williams, who's a cardiologist with Bronson Advanced Cardiac Healthcare. It is Heart Month. One thing I did want to ask you, Dr. Williams, and this has come up, we've had stories on this. How important is sleep, prioritizing sleep to helping prevent heart disease?
Yeah, that is becoming more to the forefront about sleep and getting at least 7-8 hours of sleep a night. Sleep deprivation or a lack of sleep definitely increases your risk for heart disease.
One of the other things, too, because you had mentioned earlier, sometimes family genetics enters into things and like that. When, it's for not only younger generations, but everybody, about what time should you start asking your primary healthcare physician to maybe start doing tests that are looking at your heart?
Yeah, that's a great point. And we're great at finding coronary disease and treating it. We're not very good at preventing it, and most people need to take the initiative of seeing their primary care doctor and following the guidelines that are set out to have your cholesterol checked and your blood pressure. And particularly if you have a family history of premature coronary disease, you really need to pay attention to those things.
Now, once someone develops heart disease, are there methods out there, or are there ways out there to control it and live with it?
Oh, for sure. If you're a smoker, you need to quit. If you're eating a diet high in fat, you need to lower the fat content in your diet, eat more fresh fruits and vegetables, and exercise 30 minutes a day for 5 days a week. Try to limit your stress. Also, alcohol is an important risk factor, and if you're going to drink, for men, it's 1 to 2 drinks a day. For women, it's 1 drink a day.
Dr. Williams, if people want more information on heart and vascular services at Bronson and heart disease in general, is there a place they can go?
Oh, for sure. We have primary care physicians. We also have our practice here at Bronson and at Battle Creek that they are more than welcome to call, and if they have questions or they have things that are worrying them that we can answer.
And I imagine if they go through their primary care physician that they can get referred to you for more intensive care.
That's true, yes.
All right, bronsonpositivity.com/heart. It is Heart Month in February, and you want to make sure you take care of your heart, because Dr. Williams says it's the number one killer in the world. So, but a lot of times it's very, very preventable. Dr. Robert Williams, cardiologist with Bronson Advanced Cardiac Healthcare in Kalamazoo, sees patients in Battle Creek as well, board certified in cardiovascular disease and internal medicine. Dr. Williams, thanks for joining us today. Have a wonderful day.
It's my pleasure. You do the same.